Toothache refers to pain in or around the teeth and jaws that is usually caused by tooth decay. Minor toothaches can occur from a temporary gum irritation that you can treat at home. More severe toothaches result from cavities, infection, or other dental conditions that wouldn't get better on their own. If you have a severe toothache, you will need professional dental treatment. You may feel toothache in many ways. It can come and go or be constant. Eating or drinking can make the pain worse, particularly if the food or drink is hot or cold. The pain can also be mild or severe. It may feel sharp and start suddenly. It can be worse at night, particularly when you are lying down. A lost feeling or broken tooth can sometimes start the pain. It can also sometimes be difficult to decide whether the pain is in your upper or lower teeth. When the lower molar tooth is affected, the pain can often feel is coming from the ear. Stay tuned on your favorite health TV talk show, The Physicians, where we'll be discussing toothache, the causes, risk factors, management, and prevention. It's another day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course with my regular co-host, the amazing and beautiful.
My name is Dr. Martina Agbemi. Welcome to your regular health TV talk show, The Physicians, where your health is always our
business. We're talking about toothache today.
Memuna, the way you're smiling, you look like you've never had a toothache before.
And I pray I will never have.
I journey in that prayer, Memuna. It's not what you should have actually. It's like a pain from the pit of hell.
Wow.
I haven't been to hell before, but I can actually tell you that this is a pain from the pit of hell. Memuna, you know what happened? When the annoying thing is that the pain is worse at night.
No, but if you start having the pain at the very first, I have very low threshold to pain. So the moment I start feeling it, I go and yank off the tooth.
No, it's true that
why will you be waiting?
No, it's gradual. It's not as if you are waiting.
I will yank it off. Now that you told me now, I will yank it
it's
off.
It's actually gradual. When it comes, you think like maybe I tell you.
I will not think. No, I will not think. Martina, I will not think.
Let me tell you what happened.
My pain threshold is -10. Very low.
When it happened, right? I can tell you it's really gradual. When it's just started like that, and as always this.
Okay,
took yeah, but when the pain now came that night,
midnight now, when everybody is sleeping,
there's no position. You put your head here, it's there. You put your head.
You're not being kind of pain is this? Unpaid security guard.
You are right. You know what?
You start trekking to the hospital yourself.
As by 3:30,
you already dressed.
You will sleep. By 3:30, I was up. I was prepared. By 4, and then there used to be traffic on the road. Nothing will delay me. By 4, I was already on my way out of my house. I got to the Federal Medical Health Center, the dental clinic. By 6, I was there. I was
waiting for them.
I was waiting for them to open. So that I would be the
first person. I can imagine.
When I got in, when they eventually opened, I got my card. And you know what the doctor said? He said that they would do X-ray. I said even if you do an X-ray, nothing will make me leave this place without extracting this tooth.
Nothing will make you leave this place. I'm laughing because now is in the past, so we can laugh about it. When we have an expert in the house that's going to be talking about toothache. We'll be right back after this time out. Do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today we are going to be talking about a very, very important topic, and because of the importance of this part of the body, I would want to encourage every one of you, go call your neighbors, call somebody to tune in and watch us right now on The Physicians, but of course, which is your health is our business. Today with us in the studio is a beautiful, I think I may have to add this, cute dental surgeon, and of course a registrar with Lagos University Teaching Hospital. And more, very, very important to me now, she is my daughter's namesake. She is Dr. ZAINAB SALIU. Dr. ZAINAB, you are welcome.
Thank you very much. Well, nice to be on this show with Dr. Midula and Dr.
Welcome.
Just hear her voice.
Yes.
That is why I said go and call your neighbors, because she's going to be talking to us about toothache. Because some of you will not hear, well, you still be using your teeth to be eating some things that, you know. Dr. ZAINAB, let's not even go there. What is toothache?
Okay. Toothache is basically pain from the tooth. Basically, in basic terms, pain from the tooth. So this is the tooth's way of showing that I'm in pain, I need help, there's something going on in me that is not right, my tooth is inflamed. So it's the tooth's way of saying I'm not in a good state. And the way it makes this shown is by discomfort, pain, and then there are a lot of other symptoms that you see. Headaches at times, severe throbbing pain that just keeps eating.
And the one Dr. Martina was describing.
Yes. So maybe before you go to talk about these symptoms, maybe you want to tell us something about the tooth.
Yeah.
The anatomy of the tooth and what makes people feel the pain when it comes.
Yeah.
The supply.
The tooth is it's an organ that has 3 important structures within it. There's the innermost organ, there's the middle organ, and there's the outermost organ. The outermost organ is the hard tissue that we see. Everybody sees the white one.
Okay.
The innermost organ is the yellowish one. Okay. And then the middle organ is the yellowish one, while the innermost organ is the one that is kind of pulpy-like, like blood-like. So that's the one that houses your blood vessels, your nerves, what makes it sensitive, what makes it painful. While the one in the middle is the yellow one that makes it sensitive. So when you take cold water out, it's due to the more sensitive one in the middle. But when you have pain, and there's real pain, it's due to the innermost one that has the nerves, the blood vessels, and all that. While the outer one is just supposed to cover and just make you look attractive.
And beautiful.
Beautiful.
Yeah, exactly. So now that we are narrowed down to toothache, and we are saying the pain can, like what, I will keep referring to her,
No
right?
problem, I'm available.
That she said, it's like she went to hell and back. So what are the symptoms? What do you feel when you are having this toothache?
Okay, the tooth is unique in that it's like a coconut.
Oh wow.
Yes.
I like the way you
It has
described
it has the outermost shell is really tough.
Yeah, you're right.
So for example, when you have such inflammation going on within the tooth, where you have the blood, the vessels, the nerves, it's easy for them to expand. They expand, maybe cause a bit of swelling, and then you can ease out the swelling from other parts of the body because they're like softer. There's a path they can pass through to just ease out whatever is happening. Okay, but for the tooth, it's a hard wall surrounding it. So the path to creating that pathway for it to just ease out itself, it's difficult to get. So what we have in the tooth is inflammation going on, resting on the blood vessels, the nerves. So it makes it really painful because it's an enclosed space. Everything is happening in an enclosed space. Oh. So the way the tooth does this to ease out the pain is through this forceful, really painful. Yes, let me get out of this space. That's how it is.
Okay, now I understand it better, and that will take me to the possible causes.
Okay.
Let's discuss the causes of.
Yeah. So like I've said, the tooth has 3 parts. Anything that can compromise the tooth, that can go from the outer to the inner, that exposes the tooth will cause tooth decay.
Okay.
So things like caries, dental cavities. Cavities means, when we say cavity, it's like a hole. So that means there's a breach in this protective mechanism of the tooth to the inner structure. So because the enamel also acts to protect the pulp, the blood vessels within the tooth. When there's a breach, anything that can cause a breach to that sensitive tissue will cause toothache. Okay. So things like a broken tooth. when a tooth gets broken, it exposes that inner sensitive tissue, inner sensitive and painful tissue. The first one, when a tooth gets infected, okay, infected by microorganisms, too much sugary foods also, you can also have a breach, because what happens is the enamel is acted upon by these microorganisms, so they feed on it, release acid. So in a way, it breaks down the enamel, so that's where they go in, so that's how they get into the tooth structure. So that's another way. Another way you can have that is when you do a filling. So when you have a restoration, at times there can be surface level restorations and there can be deep level restorations. So when you have surface level restorations, you are not thinking of pain, possible pain, but when you have deep level restorations, again, it is closer to the dentin. And when anything is closer to the dentin, it's closer to that painful tissue. So
sensitive.
Sensitive, painful. So anything that can compromise, anything that can compromise that connection, that inner part, will cause you to ache. So basically, that's compromise.
You're talking about abscess tooth?
Yeah. For an abscess tooth has been able to ease out itself. So an abscess tooth has found a way to release it. So whenever you have a tooth in this early stages of inflammation, they call it cellulitis. So this is highly painful. It's everywhere. There's so much pain. But when that tooth is able to find an outlet and opening to just release the pressure within it, it gets calmer. So when it gets calmer, that is when you start seeing things like swelling, things like abscesses. That means the tooth has been able to not been able to fight anyways, but has been able to release whatever inflammation is going on within it.
So that differs from toothache, because toothache is like encapsulated and is looking for way to ease out. But abscess, it eased out.
But whenever there's a block,
but the pain between that ache and abscess, which is more?
The pain between the ache and abscess, the ache is much.
Because
the abscess is chronic, but whenever there is that block in that that outlet, that pathway,
it means relief is
whenever
coming.
it goes out, there's a relief. Whenever there's a block in that outlet,
but the chances
it
are
gets
that if it's not properly drained,
exactly.
Yes, of course.
And becomes more chronic.
Of course, yes.
So are there risk factors?
Well, there are lots of risk factors actually. Okay. So one of the risk factors is poor oral hygiene.
Poor oral hygiene.
Yes.
So you're not brushing at your mouth.
Well, it may be that you're not brushing, or maybe that you can be under brushing.
So if you are brushing once a day, it's under brushing.
Once a day is under brushing.
So
you're supposed to be brushing twice a day, in the morning and in the night. You're supposed to also be flossing. It's not something that people commonly do anyways.
People still flushing as if it's for bougies.
I think you should explain more what you mean by dental floss.
Yeah.
Because people think when you do that, you're just trying to show
off.
No. Okay. Because
please do explain that.
The use of those toothpick, if it's actually active.
The tooth has surfaces called, you have the occlusal surface, which is the one on top of the tooth for grinding. We have the facial surfaces, which is one we can see. We have the palatal, which is the inner one. Then we have the interproximals, which is the ones in the middle. Yes. So the ones in between, we just consider them small. However, they are not small, because most of the teeth in the mouth usually have that surface. And this surface is somewhere where food particles are likely to accumulate. Because we see them say, but I never knew I had a cavity. It's not showing on top of the tooth. But when you look at the x-rays, it's in between the tooth. As a result of that, for you to be able to displace whatever accumulation, whatever food debris is between the tooth, you have to floss. So flossing helps you get out food particles in between the teeth, just like brushing helps you get it from the surfaces.
So flossing helps you to take out the food in between, while brushing helps you to take out the food on the surface. Hold it right there. Let's keep a date with the physicians. We heard my co-host talk about, toothache. Have you ever had that experience? Somebody who has gone through that experience. Do you think brushing a day, is the ultimate, or is best for you to just follow the rules that says twice a day, no matter how busy you are. Brush in the morning, brush at night. We'll be right back after this time out. Do stay tuned.
Yes, I know.
I guess toothache is a pain caused by cavity or infection. It's a sharp pain that disturbs people, yeah.
Yeah.
Yes, I guess I have one, but I guess I've treated it. I guess twice a month, like in a month, you should go to the doctor twice.
If the person feels so bad and it's normal, like the person, I just pray that we will not have that kind of a thing, but it's not good.
Every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. And of course, with us in the studio is no other person than Dr. ZAINAB SALIU, a dental surgeon and a registrar with Lagos University Teaching Hospital. Before we went on break, we were talking more on toothache. What is the difference between that and absence? And of course, the importance of not underbrushing and ensuring that twice a day, which has been prescribed, is what you should, follow through. And she has said that brushing your teeth is for the outer part. In between your teeth, there are some things that are there, and they don't look as if they are obvious, but they are wide enough when you look under the microscope or how the anatomy of the teeth is. And that is why it's important not to only brush, but periodically you should also flush. Dr. ZAINAB, we're talking about the risk factors of toothache, and this is where we went into brushing and flushing. Please, can we continue on that part?
Okay, so we're talking about oral hygiene practices.
Yes.
Okay, so also it's important that whenever we brush, we use dentifrices or toothpaste that contain fluoride.
Why so?
What does fluoride do is that they strengthen the tooth. They make it stronger.
Okay.
So they make it more resistant to acid attacks from microorganisms. Because actually this dental caries is actually caused by microorganisms that feed on residual food particles on the tooth. So when you have microorganisms feeding on residual food particles on the tooth, they produce acid. So this acid is actually what eats up the outer part, which is the stronger part. So the acid chelates it, dissolves it until there's a cavity, and then it goes in and then it goes bigger. So basically, the fluoride strengthens it. We call it mineralizes it. So it mineralizes it, hardens it, makes it stronger. So that is an important part of your oral hygiene procedure. So you need to have dentifrices that contain fluoride. Very important. So we talked about also some tooths are actually susceptible to caries. It's not because they don't carry out good oral hygiene. It's not because they don't brush. It's actually because they are more susceptible. And what I mean by susceptibility is, number one, if your tooth is at the back teeth are actually more prone to having dental caries. Why? Because it will be difficult to get there. The food may be hiding somewhere that probably your brushing did not get to properly. Or some teeth are actually, their anatomy is very funny. Okay, normally we're supposed to have cusps and ridges, but these teeth they have lots of serrations, lots of ridges. So it's a way it packs food. It naturally has this ability to pack food. So that even when you clean, you're not cleaning. It's not completely the residual food. Yeah, it's not completely out of your tooth. And also some teeth are actually hypomineralized. When I say hypomineralized, I mean they're not as strong. So what a decay that will make tooth A that tooth A will be resistant to. Tooth B may not be resistant to that decay because it's hypomineralized.
Just basic before we round off, right? How do you brush the movements? Number one. Then number two, Why does that pain get worse at night?
Everybody is sleeping, and nobody is telling you sorry. That's why you feel the pain.
No, it's yes, because I already asked that question before, and they say it's because the blood supply when you lie down is more to that area. Maybe you have to come from a registrar. Let's hear from you.
So I'm going to
The complications of poor dental hygiene and why the pain gets worse at night.
Okay, so I'm going to start with the toothbrushing.
Yes.
So most of our people brush by they just go all the way to the surfaces and go, you know, they just do that. Well, the ideal that method actually wears the necks of the tooth. So when you see our grandparents, you know, people that are elderly with that cavity, or even younger people, you know, with that cavity, you know that is actually as a result of their toothbrushing methods. Okay? But the normal way we should brush is with a medium texture toothbrush. You brush from the necks of the tooth down to the tips of the tooth. So you go vertically.
Okay.
Vertically,
Up,
down, up, down. Then from the down ones, you go from the down, up, down, up, down, up. So when you finish with that, you wash the surfaces of the tooth where the parts of it that perform the actual biting and chewing. So you wash that too. And then when you're through, you wash the inner surfaces, wash your tongue and the back of your tongue. I don't know if you try to get to the back of your tongue because that's where food particles sit, you know, like a towel.
Mouth odor comes from
yes, halitosis. So it's like a towel. It absorbs things. So you want to make sure you're brushing that part properly. And also, afterwards, you floss in between your teeth. So that balances an ideal toothbrushing.
Thank you so much, Dr. ZAINAB.
We talked about the
complications. Well, the possible complications for dental aches is swelling. Okay, so when you have dental ache, it's the abscesses when they don't have a pathway to drain through, because the body has potential. They call them potential facial spaces. Okay, so these abscesses will go to those. They call them potential facial spaces because these facial spaces, when something gets the fluid, they have the tendency to accumulate it, open up. So they call them potential facial spaces. So the tooth it's surrounded by, the tooth itself is in a bone. So you have a bone, you have muscles, you have ligaments. So the tooth would find if the tooth cannot find an exit through your gums, which is the abscess that we see, gum abscess, boil abscess, it can go all the way through these tracts. So it can get to deeper spaces. So with that, you see people coming down with swelling, not just of gum, of the sides of the faces. Yes. So you can, and at times you see people have holes in one part of the tooth, hole in another part of the tooth. So with that, you have abscesses connecting. So you have people with abscesses in the front part of the mouth, abscesses, you know, that goes up to the throat, to the upper respiratory area, upper airway. Okay, so it can be that severe. That's a complication of toothache, really. Yeah. So
it's now more scary, right?
Yeah, it gets more. It kills. It kills.
Exactly.
Because it kills and it's more scary. How often should people visit the doctor?
Yes.
For checks.
You should visit the dentist, whether you don't have anything, whether you don't have any dental
as part of your annual checks.
Just go twice
a year. So every 6 months.
Go and visit
On
the
that
dentist.
note, thank you so much, Dr. ZAINAB, for coming here and, you know, making toothache discussion very easy. I'm sure there's no one who paid attention today or who joined us will not, you know, gain something from this discussion. Thank you once again.
Thank you very much.
To all our viewers out there, you've heard it. Don't be like my co-host, Dr. Martina. In fact, she did not even sleep. By 3 a.m. she was ready. By 4 a.m. she went to the hospital. By 6 she was already sitting down waiting. Nobody was waiting for her. She was waiting for them. And of course, by the time they're telling her to come and do essay, she said, what do you mean? Take out the tooth. Don't be like her, right? That is why it is important for you to visit the dentist at least twice a year. Don't wait for any toothache. Just go and ask, see, I'm here. check me. Is there anything? Because sometimes things can hide in your cavity. Some people, she has already told us that some people are prone to that. And sometimes the way you brush may not be, the way it should be. So on this note, my name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Thank you very much,
Thank
Dr. Sami.
you. Thank you.
It's actually a pleasure having you as our guest.
Thank you very much.
Trust us, we'll invite you again to come and talk about something else that has to do with dental.
Thank you very
And
much.
to our viewers out there, I just want to say thank you for being part of our program today. Evidence-based medicine. I am a living witness of one that actually went through it's a harrowing experience. I don't think I don't want to wish you to go through what I went through. So the only thing I will ask and request of you is that twice annually go for your dental check. My name remains Dr. Fatina. The next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.